Hi, I'm Julianne Callaway. I'm a strategic research actuary. I focus on topics that are new and emerging for the life insurance industry. One of those topics is wellness, how our lifestyle decisions, our behaviors, are going to impact mortality experience. The World Health Organization has identified the rise of non-communicable diseases as a profound global health threat. Lifestyle behaviors, such as physical inactivity, poor nutrition, and smoking, contribute to diabetes, heart disease, certain cancers, and all of those contribute to 50% of premature deaths worldwide. To better assess the impact of lifestyle behaviors on mortality experience, we used two large national data sets to build multivariate Cox proportional hazard models. We compared hazard ratios for a variety of metrics that include steps, physical activity, and smoking to see how they impact lifestyle behaviors. When we look at steps, we find that the lowest quintile, the worst 20%, have much higher mortality experience than the rest of the group. Steps have an intuitive appeal as a metric to measure activity. They're quantifiable, they're objective. They're a metric that has been around for a very long time, since the early days of pedometers. And because they've been around for so long, we now have the ability to understand how steps relate to mortality experience. But one main drawback to assessing physical activity with steps is that not all activities are quantifiable using steps. Consider if you're a swimmer or you're a tennis player, steps might not be the best metric to assess the level of activity that you are engaging in. So to better understand physical activity and how it relates to mortality experience, we looked at self-reported data. Now it's important to note that self-reported data from a national survey where people are not incentivized to lie might be different than an insurance application. Nevertheless, this study is important so that we can understand really how big of an impact physical activity has on mortality experience. And what we found is that people who assess that they've had a low amount of physical activity have much worse mortality experience than those that say that they have high levels of physical activity. Now, one thing you might note is that there's less of a difference in the hazard ratios for those who report low activity than those who had low amounts of steps. And there's a few reasons for this. One is that there could be a difference in perception. People could perceive that they have a higher level of activity than they actually do. Another important difference is that people who have high amounts of steps, the steps are reflecting their activity throughout the day, whereas the question that asks survey participants about their activity levels focuses on their leisure time activity. So these are important differences in the metrics of using self-reported activity data versus steps. So to understand if the results of our self-reported activity analysis were reasonable, we also investigated the experience of these people who report their activity and their resting heart rate. High resting heart rate is associated with higher levels of mortality experience. And we found that people who reported low levels of activity also had high resting heart rate. Likewise, people who reported high physical activity had low levels of resting heart rate. This is an indication of the validity of our self-reported analysis. We further investigated physical activity by looking at activity intensity and understanding how experience changes by age. This chart shows mortality experience for people who exercise 2 to 6 times per week relative to those who don't exercise at all. As you would expect, people who don't exercise at all have higher levels of mortality experience than those who exercise 2 to 6 times per week. What's interesting is that the difference increases with age. So what we can find from this is that physical activity is important to mortality experience, but it's even more important as we age. If you look at the bottom of the chart, that shows the experience for people who exercise vigorously, and the difference is even greater there. So what we know from this analysis is that exercise is more important for people as they age, but that's especially true for people who exercise vigorously. Another very important contributor to lifestyle-related mortality is smoking. To better understand smoking on mortality experience, we looked at both the amount of cigarettes smoked and the time since quitting. And perhaps not surprisingly, the more one smokes, the worse the mortality experience. But even smoking half a pack a day leads to an increased mortality experience. People who've quit within the past 5 years do have improved mortality experience relative to current smokers, but they still have an increased level of mortality. On the other hand, people who quit more than 10 years ago have almost the same experience as those who have never smoked. We combined these two lifestyle behaviors, smoking and physical inactivity, to assess how the two related to mortality experience. Those who report that they are less active than their peers have worse mortality experience than people who report that they are more active than their peers. However, there are differences in experience based on whether or not you smoke. People who report that they are current smokers have worse mortality experience regardless of the level of physical activity. In other words, if you're a current smoker and you're physically active, you will still have worse experience than somebody who doesn't smoke, who is inactive. Lifestyle behaviors influence mortality experience. Exercise is an important contributor to mortality, and exercise, especially vigorous exercise, is more important as we age. But it's important to remember that smoking remains an important contributor to mortality experience regardless of your level of physical activity. This is an evolving area of interest that's exciting for the insurance industry. There's new technology and new data, and it's always changing. If you would like to learn more about the details of this analysis, I encourage you to read the white paper on this topic that I co-authored, or to send me an email with any of your questions. And with that, I thank you for joining me today, and I look forward to hearing from you.